Landing in Ireland, it's easy to assume you'll have instant access to a smoothly running, free European healthcare system. The reality is much colder. The Irish healthcare framework is highly structural. Everything is heavily centralized and strictly gate-kept, which is entirely different from the on-demand, walk-in models you might be used to back home. In Ireland, the local general practitioner is your mandatory entry point to all medical services. But right now, these standard neighborhood clinics are operating strictly on a prior registration model, and almost all of them are facing extreme capacity limits. Catch a flu and walk directly into an unregistered local clinic? Reception will turn you away. Pivot to a public hospital's emergency room for that minor illness, and you trigger a mandatory €100 non-referral fee, waiting up to 12 hours. Without a clear understanding of where to go, a minor infection leads to significant delays or high out-of-pocket costs that are difficult to recover. To survive the academic year, you have to abandon the assumption of immediate convenience. You need to master a highly specific, tiered triage system to get the right care at the right price. Tier 1 of this strategy handles the basics, treating minor winter bugs and headaches with over-the-counter medications. You can buy simple painkillers at grocery supermarkets like Tesco or Lidl, but strict safety laws limit you to purchasing just 12 tablets of paracetamol per transaction. If you need larger quantities or stronger cold treatments, you have to step up to a licensed pharmacy counter, which can dispense larger pack sizes. But there are rules here, too. If you request stronger coating-based relief like Solpadeine, Irish law mandates a screening interview. The pharmacist will question you on your symptoms and medication history to ensure safe usage. You also need to distinguish between regulated medicines and retail wellness products. Supplements sold at health food shops like Holland & Barrett are legally classified as food. They cannot treat acute bacterial or respiratory infections. Supermarkets work for temporary relief, but managing a lingering infection requires the professional screening protocols only found at a pharmacy counter. Tier 2 comes into play when you actually need a doctor for an infection, a blood test, or a prescription, without checking into a hospital. The biggest financial advantage available to you as an international student is your university's on-campus student health center. Because your student levy subsidizes these facilities, triage consultations with campus nurses are usually free. If you need a visiting campus GP, the appointment typically costs between €10 and €20, far below the standard private rates. The downside is availability. These centers run strictly on academic schedules. They close during weekends, evenings, and term holidays. For off-hours acute care, the most reliable alternative is a private walk-in clinic network like Doctor.ie. This network operates outside the traditional community bottleneck. They offer same-day, face-to-face consultations to any passport holder for a flat €60 to €90 fee. No permanent prior registration is required. If you use these services, always pay those high private fees using a 04x card to keep unnecessary bank exchange markups from inflating your bill even further. You will constantly weigh these two options, trading extreme cost efficiency on campus during the week for immediate but expensive convenience at a private walk-in clinic on the weekend. Tier 3 is for true life-threatening emergencies requiring public hospital accident and emergency, or A&E departments. Remember the rule. Arriving at an A&E with a non-life-threatening issue and without a formal doctor's referral letter results in an automatic €100 charge. Worse, bypassing the proper triage tiers means you will be stuck in a waiting room for 6 to 12 hours while staff prioritize genuine trauma cases. You can avoid this charge entirely with a referral. If a campus doctor or walk-in GP determines you need hospital care, they will issue an official letter that waives the €100 fee at the reception desk. Paying out-of-pocket for private clinics or hospital visits brings you to the final hurdle, claiming that money back through your private health insurance. The most common reason international students miss out on refunds is failing to understand their policy's outpatient excess threshold. The excess is an out-of-pocket amount you pay yearly. If your excess is €100 and you spend $140, the insurer subtracts that €100 limit and reimburses the remaining $40. Clear this hurdle by uploading stamped clinic receipts for every visit to your insurer's app. Successfully recovering your heavy medical costs requires treating your clinic paper trail with the exact same rigor as your academic assignments. Navigating Irish healthcare effectively comes down to matching your immediate need and student profile to the correct tier of care. If you are heavily budget conscious, always default to your campus clinic for primary care and rely on thorough pharmacist consultations for minor winter bugs. If you are time poor and struck by a sudden illness right before weekend exams, immediately leverage a private walk-in network to get your diagnosis. You can rely on your insurance paper trail to recover the funds later. Before an illness strikes, build your infrastructure using this 4-step checklist. Step 1. Save your campus clinic's hours. Step 2. Download a pharmacy app like McCabe's. Step 3. Find your insurance outpatient excess. And Step 4. Book a €30 seasonal flu shot. For more comprehensive guides on student budgeting, accommodation, and travel, visit myflightoffers.com. Managing these medical logistics ahead of time means that when you do get sick, you can focus on your recovery instead of the bill.